Hi, everybody, and thanks for joining us. My name is Elisa Lapolt, and I'm the Policy and Advocacy Director for NAMI, Tennessee. And this is our Grassroots Advocacy Training in which we learn how to write our story about our experience with mental illness and how to tell that story to important decision makers like legislators. So I'm going to walk you through a PowerPoint, and then we're going to take a little bit of a break to chat, and then we'll resume with some of the more logistical approaches with how to contact your legislator. Okay, so I'm going to get my PowerPoint ready, and I'm going to share my screen. Let's see, share screen. Okay. Let's see. And we will get started. So as I mentioned, this is the preparation for our day on the Hill next week. And I know that a lot of people get a little nervous about speaking to legislators. And I can tell you, I've been doing this for close to 20 years. And nearly everybody walks away just stunned and surprised. And what they say is, wow, they were so nice to me. The legislators listened to me. And the reality is that they're regular people like the rest of us. And they've been affected by mental health challenges as well. So we'll go ahead and get started. This is what we're going to do today. You're going to learn why advocacy is important, how to tell your story, how to contact policymakers, and what to say to them. Now, what we need you to do between now and next Wednesday is to email your legislator. Okay, you'll have a House member who represents you and a senator who represents you, and you'll need to ask for a meeting. Okay, I'm going to walk you through how to do that, so don't be alarmed. It's really easy, and like I said, they'll be very nice. So what will you get from this webinar? You're going to have a version of your story that you can use in a number of different places for a number of different people. It'll be a condensed version, very succinct and very impactful. And with that, you'll have a tool to raise awareness, whether that's friends, family, community, church, so many places that you can take this story. The idea is to have the story in place so that you can have something solid, and when you speak, you can have confidence to inspire others, and you'll have the ability to influence policymakers. So we'll start with why advocacy is so important. And the first thing is, it's because every Tennessean who experiences mental illness deserves the opportunity to experience recovery as well. And by recovery, what we mean, we don't necessarily mean the absence of symptoms or the life that we expected, but instead, by recovery, we mean managing life with mental illness, including improving our health and wellness, striving to reach our potential, and to form meaningful connections with others. So another reason it's so important to have advocacy and to engage in advocacy is that we know that treatment works and recovery is possible, especially when we feel like we're valued as a whole person and our individual perspectives and needs are respected. And your story is the perfect way to share this concept with other people, especially policymakers. And we know that statistics show us that 1 in 4 to 5 adults experience a mental health disorder. 1 in 20 adult lives have a serious mental illness, such as schizophrenia, major depression, or bipolar disorder. And more than 1 in 5 children and youth has a serious mental health condition. And of course, we're seeing that now as a result of the pandemic. So we know that mental illness affects everyone, regardless of race, ethnicity, sexual orientation, gender, age, or political party. Okay. And even though mental illness is common, most people don't get the help that they need. There's an average delay of 8 to 10 years from the time that symptoms show up, from the time that they get a diagnosis and treatment. That's the average length. Fewer than half of children and adults with mental health conditions receive any at all. So there's a lot of untreated mental health conditions out there. And those that do receive treatment often don't get the services and supports that they need. And I'm sure many of you have experienced that. So when we don't have the services in place, when individuals don't have access, there's a high price to pay. One is school failure. Students with serious mental health conditions have the highest dropout rate of any disability group in the country. We also pay a high price in unemployment. Most adults with serious mental illness don't get the supports that they need to get and stay employed. We also pay a high price in homelessness, and I'm sure some of you have seen this in your own communities. 1 in 4 homeless individuals lives with a severe mental illness. When people don't get the treatment and help in maintaining a job, they often wind up homeless. And finally, in criminalization, when youth and young adults don't get the treatment they need to manage their illness, they often end up in jails and prisons. So this affects our future as a country, as communities, because without mental health care, we sacrifice our future to suicide. Every 15 minutes, we lose 1 life to suicide. It's the 10th leading cause of death in our nation and the 3rd leading cause of death among people aged 10 to 24. Most people who die by suicide were affected by mental illness. Oops, hold on. So again, why is advocacy important? It's because our stories make a difference. We need to speak up about the things that matter. We need to speak up about protecting mental health funding, expanding access to mental health coverage, and ensuring that mental health services are available. Your story is a way to speak up, and it helps us illustrate what happens and what helps. By telling your story in a compelling way, you can change attitudes and influence policymakers' support for mental health. So I'm going to stop there and ask a question. Why is advocacy so important to you? And I'd like you to put the answers in the chat box. And I can go ahead and start. For me, advocacy is important because me and my family have been affected by mental illness personally or by family members. And I want to make sure that no one else has to suffer. I want to make sure that people get the help that they need before it's too late. And I want to use all my skills and talents to make that happen. So Katrina, my voice and input matter. They do. And you'll see that when you're advocating at the Capitol, at the Cordell Hull building next week. As a clinician, I see barriers clients face to getting help. I also see the consequences of them not getting the help that they need. Yeah. Kimberly says, seeing the stigma it has caused and that communities learn and get educated on mental health. Yeah, these are all great. Jarvis, nobody can tell my story like me, and representation matters. Yes. Personally, so this is from Fiona. Personally, it's so clear that other young people and people of color can have better experiences than I did. Thank you. Sue says 10 years of an ill working system, there's a better way. These are all great. And I can just feel your passion and commitment here. Wow, Don, this is deep. Advocacy is restoration, restores justice. Woo, man, truth. Jarvis, yep, finally ready to kick the stigma in the teeth. Mental health is health, period. Gosh, you guys are awesome. These are great answers. Advocacy is important to me because there are so many unheard stories. We need to be their voice. Thank you, Sammy, because we know when we're in a mental health crisis, just speaking up is so difficult. And so we need to be the voice for other people who are struggling. Scott says, as a certified peer recovery specialist, congratulations on that, by the way, I have experienced the power of recovery. Many are simply uninformed of the significance of mental health. I want to be a voice for those without a voice. Wow. Yeah, you guys get it. And that's why you're here. And I truly appreciate you being here. And I'll be teaching you how to tell your story. So we're going to get right on that. So thank you for sharing. I'm going to go back to sharing my screen. Right. Well, Zoom slides. There we go. Okay. So what I want you to do is be thinking about the story that you want to tell when you're meeting with legislators next week. And if you're not able to join us, you can send them an email. And NAMI Tennessee focuses on 40 to 50 bills each year going through the Tennessee General Assembly. And we're going to have a list of about 10 next week that we'll be focusing on. But for today, I'm going to give you about 5 issues. And I want you to think if any of these resonate with you and how you can shape your story around these bills. Because what we're trying to do is either support legislation or oppose legislation and use the power of our story to influence whether the bills pass or fail. Okay, that's how it works. So these issues, if you want to become more familiar with the issues that we're advocating for or against, go back to the recording of last week when we did our legislative briefing. That is available on the NAMI Tennessee website under advocacy and 2023 advocacy series. The recordings will all be available there. All right. So these are very straightforward bills and pretty cut and dry. The first one is Senate Bill 856, House Bill 976. It would make it possible for firefighters to get help for PTSD through workers' comp insurance. So right now, workers' comp doesn't cover this because it's not considered an on-the-job illness. This legislation is interesting because it recognizes that cumulative stress and trauma, these people see trauma sometimes on a daily basis. That causes PTSD. And we want them to get the help that they need ahead of time, because there was a firefighter by the name of Dustin Samples in Cleveland, Tennessee, who died by suicide because he couldn't get the help that he needed. And this bill would be named after him. It would be the Dustin Samples Act. And the firefighters came to Senator Bailey with this legislation. And although it affects firefighters right now, Senator Bailey has said that he would like to open it up to police, other first responders in the future. So think about how your story about access to mental health treatment, therapy, and so forth could be an example for firefighters, and in telling your story to legislators to help convince them that this is important. Okay, the second one, and I know we've got some college students here, it would require colleges and universities to print contact information for mental health and suicide crisis lines on student ID cards. Okay, so obviously we support that. So here's one that we oppose, and there could be some really compelling stories here. So Senate Bill 1334 and House Bill 1192 would actually allow the state, it's the Housing Development Authority, Tennessee Housing Development Authority. It would let them create camps for homeless individuals, which sounds okay. But the thing that we're concerned about as NAMI Tennessee is it would make it easier for these individuals to be involuntarily committed for mental health treatment. And that's where we have an issue. So if any of you have been involuntarily committed, this would be a very compelling story to tell about your experience with this. And we oppose this bill. All right, we've got a couple other things that we're advocating for. And again, think about how your story could promote these issues. Governor Bill Lee, in his budget recommendation to the legislature, put $9 million in for mental health and substance use disorder pay raises in state facilities. Now, this is important because we have a shortage in the workforce of behavioral health professionals. And one of the reasons is they're not getting paid enough, and they hadn't received a raise in over a decade. So last year, the governor put in $18 million for pay raises, and the legislature approved it. And that's in this year's budget. And there was a request for another $18 million from the Department of Mental Health and Substance Abuse Services. That would have done the second half of the pay raises. But the governor put in $9 million, which we're grateful for. Okay, we always want to remember that. But we want to ask for 18 again. So the ask for legislators would be to increase the governor's $9 million to $18 million. So in this case, be thinking about how, if you had accessed mental health services earlier, could that have helped you? Or if you're a mental health professional, how long you might have waiting lists to see clients because your colleagues are either they're also booked or they're leaving the industry. Okay. Then finally, 988. Now, we had a webinar 3 weeks ago about the 988 crisis system. As many of you know, 988 is the new 911 for mental health. You call 988, you get connected to a dispatcher, somebody who's trained in mental health resources, mental health calls. And the idea is to be routed to services in your area, in your community. But, and this is new, this just started in July. How long is it going to take for all the services to be there? Do we have counselors in the communities? Are there waiting lists? Are there beds available in treatment centers? That's what we're trying to figure out. So this is brand new, and we're trying to educate legislators this year on the 988 system. A lot of them don't know about it. A lot of people in general don't know about it. So if we educate them now, then it's on their radar screen, and we want to be able to see benchmarks. We want to see reporting, signs of success. How many calls are answered? How many calls are dropped? How are these people routed to services? So while there's not a bill this year on 988, we're going to be educating lawmakers. Okay, now the fun part. We're going to create your story. So this is the time when you get your pen and paper out. And I'm going to just stop and see. Okay. Oh, so a question came up at my local meeting yesterday. Will this include volunteer firemen? I don't think so. This is paid because this is the workers' comp is part of their benefits. So I think it's only for employed firefighters. I used to be a crime reporter. I understand that completely. I used to be a journalist. I used to be a political reporter and a crime reporter. So I get it, Joan. Yeah. Okay. Excellent. So we are going to get to the fun part of writing our story. The idea here is to write your story, and then I'm going to show you how to use it and how to contact your legislator and how a meeting will go. Okay. Now, I'm going to start with my story. And as I explain my story, for advocacy, I want you to go through this list 1 to 7, and I want you to see how my story hits all those points. Okay. So, hi, my name is Elisa Lapolt, and I am a member of NAMI, Greene County in East Tennessee. 6 years ago, my sister died of a brain hemorrhage after years of heroin addiction. 3 years ago, her son, my nephew, died of suicide. After that, I was diagnosed with anxiety and PTSD. I was lucky to find a therapist who could help me through my grief and guilt about not being able to help them. This therapy really helped me. How I'm different today is that I'm more productive and I can concentrate better on my work. I'm happy, I have a great life, and I now teach other people how to get through their own mental health challenges. I'm concerned that other people will not be able to access therapists like I was able to do. Right now, people are waiting weeks to get therapy appointments because there aren't enough therapists to go around. Some therapists aren't even in their insurance network. I had to pay out of pocket, but I was willing to do that and could afford to. Many other people can't. We need more health professionals to help others in crisis. We need to encourage more of them to go to school and become mental health professionals. We need to pay them more money to stay in their jobs and help people like me. Other people like me could benefit from therapy for grief, anxiety, and depression. They wouldn't have to take time off work because they can't get out of bed. They wouldn't have to take short-term disability or quit their jobs altogether. Although these things didn't happen to me, this is what's possible when people experience grief, anxiety, and PTSD and depression. So I'm asking you to fund $18 million in the state budget this year to help stop the shortage of mental health professionals in our state. This money would go towards pay raises for mental health and addiction treatment professionals who work in state hospitals and community mental health centers. Tennesseans need their help. Will you please support the funding? Thank you. So that's my story, true story. And I do want to make a note here that as you're writing your stories, you may get triggered. A lot of our stories are difficult to tell. And in the event that you are in a meeting with a legislator or telling your story to somebody, it's okay to get choked up. I think that when we're authentic in our storytelling, that's where the impact can be. Oftentimes, we're the strongest when we're the most vulnerable. And it's okay to show some emotion. But I do want to tell you also to be sure that you're able to get through without a complete breakdown. I'm able to tell this story, and today is my nephew's 23rd birthday. He would have been 23 today. And it's okay. I can tell the story now. Thank goodness, thanks to the therapy. And again, these stories are emotional. Some of are heartbreaking, and I do appreciate everybody who has the courage to share their stories. Okay, so we'll get started here with the introduction. This is the easy part. As we write out our stories, you want to start out just like I did. Hi, I'm Elisa. I'm a member of NAMI, Greene County. And you want to say, if you're a member of NAMI, you want to say maybe what you do if you're a therapist. The second thing is you're going to share how you're affected by mental illness. And the third is to state your issue and position. Right? So I'm going to give you maybe a minute or so. Okay. If you're not finished, you can come back to this. One thing to remember is you don't have to write out full sentences. You can just do bullet items just to jog your memory. Okay. Also, as you're developing your story, this can be about you or a loved one. Okay. So we'll go to the second. Now's the part of the story where you talk about what happened. Like I talked about my sister and my nephew, that sets the stage for your story. What happened before you got the help that you needed? And this is where you need to keep it really short, literally 2 sentences, because the policymaker, the state senator, they're not your therapist. Just keep it very brief. Okay, so I'm going to give you about 1.5 minutes for this. I'll give you just a few more seconds. Okay, we'll wrap that up and go to the next question. This is the part of your story where you talk about what helped in recovery, or say in the case, if you've lost somebody to suicide, what would have helped. Okay. And you want to offer some hope. And the idea is to create a hopeful tone and show the value of the services and supports. You're showing the need, and then you show the value. Okay. I'm going to give you 2 to 3 minutes on this one. Okay, I'm going to give you another minute. Okay, we'll wrap that up. All right, so now we'll go to number 4, and we're halfway there. How I'm different today. So this is the opportunity to share what's going right in your life after this experience, or about the person that you care about. This could look like how you're experiencing recovery, how you're living your life. And this concludes your story on a positive note, because we want to be inspirational. Now, if you have a story that involves someone who died by suicide, that is not a happy ending, obviously. The suggestion I have here is to share your observations, because when we have this happen, our lives are never the same. But like in my case, now I'm passionate about helping others. So it would be helpful to share your perspective and observations and your passion for advocacy. So that would be inspiring. I'll give you 2 minutes here. And if you're just joining us, we are working on our stories to share with policymakers. Okay, I'll give you a few more seconds. And if you want to see a list of the questions, we have a sample worksheet that I have posted in the chat box. You'll have to scroll way up to the beginning, and it's a PDF file that you can open, download, and print. Okay. We're going to go to the next question. And again, there's 7, so we're almost there. What is the need? Mention the problem or need that you want addressed. So like in my story, I said people need access to therapists. We need more therapists available to see people. And then you want to transition to the challenges faced by people living with mental illness. So in my story, I said people need to see therapists to get through the grief, depression, anxiety. So if we're framing this around legislation, people need services available when they call 988. Firefighters need access to services. We all do. Students need access to resources and to understand where to quickly call for information. Okay, so give you a couple minutes on that one too. I'll give you one more minute. Okay, so we'll wrap up that question. And we're going to go to number 6. What will help others? So this is the part where you transition from your experience and look at how others can benefit from what you're asking. Talk about what will help. And you want this to be 1 or 2 sentences. Let your listener know what will address the need or problem you described. Okay. I'll give you 2 minutes here. If you're just joining us, we're writing out our stories to share with policymakers. Okay, we'll start wrapping this up. I'll give you a few more seconds. Okay. And we're at the end here. Last question. What is the ask? So this is where you ask your state senator, House member, school board member, whatever policymaker you're working with here, if you can count on their support or opposition. You want to include a bill number if possible. Now, for this story, we don't have to use bill numbers. Just know that next week when we are at Day on the Hill, that we will have a list of bills for you. In fact, we'll be posting those online in the next day or so. Okay. So I'll give you a minute here just to write it out. Again, bullet points. You don't have to write it out in full sentences at this point. Okay, wrap that one up. Okay. So if you want to join us back on screen, that would be great. So your bright and shiny faces. And I want to welcome Jeff Layden. Jeff is our executive director of NAMI Tennessee. Actually, your timing is really good. So we just finished writing out the stories. And for everybody who walked through this exercise, I'd love to hear, how does this feel to you? How did you find this experience? You can put it in the chat box, or you can raise your hand and I'll call on you.
I'll go.
Okay, Sue.
It is emotional. You just start reviewing everything you've been through, and it's how do you get all that and condense it into a short story? So it can be emotional.
So what you could do here is just write it down, write it down, write it down.
Yeah.
Almost like journal it. Give yourself 30 minutes to just write it all out, and then take a yellow highlighter and pick out the key pieces, the most compelling thing. Okay.
Okay.
So thank you for sharing that, Sue.
Mm-hmm.
Jarvis, you had your hand up.
She kind of mentioned what I was going to say. I know the first time it was very overwhelming to try to figure out what story I'm going to connect. But this time around, and I really wasn't working on it, I was mentally working on it. It's more succinct this time around. So if this is y'all's first time, don't be freaked out by how overwhelming it feels. Maybe run through it again offline, off the meeting, and it might make more. It might come more seamless then at that time.
Thank you, Jarvis. So Jarvis joined us, I think, our storytelling exercise last time. It was the first time you had done that. So yeah, it can be overwhelming for sure. And that's why it's good to have it written down when you meet with a legislator, because if you're just winging it, I might be crying and having somebody hand me tissues. The idea is to have it already, to have it rehearsed. And honestly, if you were to write it down and use it next week, you can read from it. I have seen people do that in meetings with legislators, just say, excuse me, Senator, or Representative, can I just read this to you? The other thing is that you could email them this story. Okay. And we're going to talk a little bit later about how this story can be used in a number of different ways. Okay. Anybody else want to share their thoughts about this exercise? So Dawn says it helped organize thought. Suzanne says it's a great way to organize our thoughts. That's pretty consistent. Challenging to stay focused with such an emotional topic, and especially considering we have such little time with legislators. Okay, Suzanne brings up a really good topic because you're going to have 15 minutes or less with legislators. Their appointments are back to back, stacked all through the day. And again, you might not be able to share if there's 5 of you in a meeting with the legislator. Say you're all coming up from Chattanooga and there's 5. You're coming in from Gibson County. And there's 3 of you. Not all of you will share your story. That's why you can always email it later. But you're still going to walk away with a great story after this webinar. Okay, so I shared my story with you all. Do I have any volunteers? Who wants to share your story? Nobody?
I can give it a go.
Okay, Jarvis.
This is kind of a wing. I mean, I have the prompts.
Okay, but I'm having a little bit of trouble hearing you. Is anybody else having trouble hearing Jarvis, or is it just me? Okay.
Any better?
All right, talk a little bit more. Let me see.
So I'll just try it. So my name is Jarvis. Live in Davidson County, Bellevue area. I have lived experience with bipolar disorder, diagnosed in 2014, my senior year of college. I did not think about the issue that I wanted to state. The 988 will be the issue. My position is for it. What happened to me in my situation with mental illness, I'll take you to a time most recently, 2020, which was my last inpatient visit. Had me and my wife been aware of 988 being an option to us, I wouldn't have spent those funds going to the emergency room and having my parents drive up from Athens, Alabama. And there's just a lot of stress that was extra stress that was impacted on my people connected to me that did. I was good. It was my second time going through it, so it was different than the first. It wasn't as scary as the first time, but it was the first time for my wife, and it was detrimental for her. I know it was very stressful and traumatic for her, and for my folks. So having access, having more advertisement, more funding for 988 would be very beneficial for not just folks with diagnoses of mental illness, but all people. And that's pretty much what I have right now. I'm sorry, Alyssa. That's not everything, I guess. But
Oh, it's great. It is great. So the need, you said the need was advertising for 988. People need to know that these services are available. They need to, because it could have prevented a lot of trauma that your family experienced, right? And so then you would just need to follow up with, like in this case, like I said earlier, we're asking legislators to become aware of 988 and to learn. The ask would be, can I count on you to learn more about 988?
Simple.
So you're on it. Thank you, Jarvis.
Yes, ma'am. Thank you.
Yeah. Okay. So Suzanne, do you want to share yours?
Sure. Well, I want to give everyone else a chance first, but if there's someone else who wants to go first, give them priority.
I know you're great. You go ahead.
Okay. Well, I am a licensed professional counselor, mental health service provider, and I work for the Hope Center of Cannon County, and I am also clinical director for the Family Counseling Center of Middle Tennessee. And I am also involved with the Tennessee Diversion Coalition and co-chair our emergency departments committee. The reason I got involved in these advocacy efforts with the Tennessee Diversion Coalition is to address the problem of ED boarding. I got involved in these efforts after a client of mine had a very traumatic experience in the ED. She came into my office for the intake. It was my first session. She was suicidal. She had 2 previous suicide attempts. I did not feel that she was safe to leave my office. So I called and had a law enforcement officer come, had our office call, and also called mobile crisis to have them do an evaluation. My client left voluntarily with the officer to go to the emergency room. And a lot happened after that should have never happened. She was in the emergency room for 5 days. I had gotten a call right after she had gone to the emergency room. I got a call a couple of days later from her. She had called the office and left a message for me. I was a little confused because I thought, well, certainly by now she has been admitted to a psychiatric hospital and they don't allow cell phones. So I became concerned that she had left AMA because I knew she had left voluntarily. And so I called law enforcement back and they went to the ED to check to see if she was still there. The officer called me back, said, yes, she's still in the emergency room. And so that's when I decided to get involved personally and went to the hospital and had a release form signed, and the charge nurse helped let me talk to my client. I offered to call around because I found out she was still there because she was 35th on the waiting list for a bed at the psychiatric hospital, the Regional Mental Health Institute, where they were going to transfer her. I asked if I could call around and find another hospital that would take her. And the charge nurse allowed me to do that. I found another hospital that would take her, but they said they needed a negative COVID test. And the hospital where she was in the emergency room, the charge nurse there said, well, that's ridiculous because it'll take 7 days to get the results and she'll be out of here by then anyway. So she stayed in the ED for 5 days. She told me that the ED staff jumped all over her for calling law enforcement when I'm the one who actually called law enforcement. And She said the law enforcement officer jumped all over her for calling our office and harassing us. She was not harassing us. We want clients to reach out if they are in distress. She was in a room about the size of a walk-in closet, 4 gray walls, nothing but a gurney, a bedside table, and a chair. No social interaction. She was not allowed to bathe. She was not allowed to brush her teeth. She had to go into take sponge baths in the sink to clean up. She had some GI distress. She also had a couple of health issues like shingles and fluid on her lung. There was no indication in her record that this was even being treated. And finally, after 5 days, she was transferred to the psychiatric hospital. She was there for an hour and then told she no longer met the criteria for admission and was sent home. And she was still suicidal. And I had to work with her for months to process this trauma from her ED stay before we could even get to her other issues. And so that's why I became involved in this issue. And we have a bill in the legislature this session that is one step toward improving these conditions. And it has to do with the electronic bed registry and requiring psychiatric hospitals to keep it updated. It's mandatory for them to update it twice per day. So this will help acute care hospitals know when there is bed availability and hopefully reduce the wait times in the ED.
And what do you want the legislator to do? What you're asking?
I would like for you to support this bill, and can I count on your support for this bill?
Very good. Very good. So thank you, Suzanne. You all can see what a compelling story Suzanne has. And like many of you, there are so many twists and turns and injustices that you want to speak about. And you might literally have 2 minutes to talk about it. So Suzanne, can I give you some quick feedback?
Sure. I know it's a little bit long. I may have to condense it.
It's okay. I don't know about anybody else, but when you said she was 35th in line to be seen, that's shocking. That statement alone speaks volumes. And so you could condense it to, you had this patient, she was suicidal, you got her into the ER, you got the phone call, thought she had been treated, 35th in line, and it was 5 days before she was treated. And I had to help her through the trauma of this. That's huge. That's the way I would recommend condensing it. Now, and this applies to all of you, the legislator can, or policymaker, whoever you're speaking to, could always come back and say, tell me more, okay? You can also email them. So that can be really helpful. Does that help, Suzanne?
Certainly.
Okay.
Yeah.
Okay, good. Thank you. All right. All right, last call for volunteers. You guys are doing great.
Okay,
Hi.
I'll give it a go.
Okay, Sue.
All right. Hello, my name is Sue Murphy. I live in Mount Juliet. I'm involved with NAMI, Williamson County. For the past 10 years, I've been helping my son who has schizophrenia to navigate the mental health world. It has really opened my eyes to a system I knew nothing about. There's lots of wait times, finding the right counselor, cost involved, what insurance covers, what they don't, length of stay as an inpatient, outpatient treatments, the wraparound services. They are all challenges that I've experienced with my son. Upon discharge from a hospital, my son had a follow-up appointment the next week, and this goes to all this wraparound services. It was great. They said next week he'll get a counselor. This is after many years. He was stabilized pretty well during the hospitalization. He had a little bit of insight, and he probably wouldn't decompensate within a week. Unfortunately, when we arrived at our appointment, there was no counselor who would take a Medicare, Medicaid patient. So we had to find someone else, and that was a 3-week wait. What if they did have someone? Within 3 weeks, my son can easily decompensate because it's a battle to get him to take his medications. So what if we had someone there? I have to say, each clinic visit I have experience with my son, I did see compassionate people who do want to help, but are met by insurance obstacles, funding issues, just not enough helping hands. There is hope because there are caring people wanting to give hope. So we do need more therapists, maybe some more long-term facilities, more long-term stays in a hospital. I don't know how that all works with funding, but there are chronically ill, mentally ill patients out there who need time. And maybe a faster way to approve Medicare, Medicaid therapists. And this way our patients can be seen more quickly. And we need to pay them more. This is a tough job, just like any other illness. Can we invest more in our citizens suffering with a mental illness? That's a condition like any other illness: hypertension, diabetes, dementia, Alzheimer's, kidney failure. We can all benefit by helping our neighbors heal. I thank you for listening. And will you please support Bill, the bill number? May I get your support for more funding, more money for our loved ones?
Wow. Good job.
Really? Hey,
Yeah.
did it make sense?
So I don't know if the rest of you noticed this, but early on, she summed up everything real quick. In and out of hospitals, doctors did this and that. Like Suzanne's story, there's so many details to be shared. And the other thing is what would have helped. That was critical. He would have been seen and not lost 3 weeks during which time he decompensated. So that's a good example of, again, what would have helped. And then also the hopeful piece, like you were complimentary of the people who did provide the help. So that was another piece that I like that you added in. So everybody did a great job. I mean, this is really good. Suzanne, Jarvis, Sue, awesome. Okay. So now you have these stories, and if you want some time working through the stories, I can stay on after this and help you work through them, okay? But I'm going to show you now how you can use these stories. So we'll go back to the PowerPoint. Okay. So now that you have your story, like I said, you can send this to your legislator in an email. If you're not planning on joining us next week for a Day on the Hill, you can send this to your legislator. Maybe you want to use this in a speech. I know like Rotary clubs and Kiwanis clubs are all the time looking for speakers in your community. This is a great example to show what's not working in the system, what mental illness looks like, and what help is needed. Okay, so you can do this in meetings. You can even write this as a letter to the editor for your newspaper. There's just so many different ways to use this. And it's not limited to legislators. We're talking about this today in preparation for a Day on the Hill, but say if there's an issue regarding mental health access for students, you can go to your school board, your county commissioners, health departments, like law enforcement. NAMI Tennessee is very involved with getting CIT training in law enforcement. That's crisis intervention teams, teaching law enforcement officers and first responders how to respond to someone in a mental health crisis and how to get them help. Veterans, hospitals, basically, here's my story and will you help me? Your story can be powerful. So why specifically policymakers? In this case, our state senators and House members. It's because they decide what gets funded in the state budget with regard to mental health and substance abuse. They decide how much they get funded and where the money goes. So it might go to funding for K through 12 mental health services or first episode psychosis. There's all kinds of different ways. This year, they're focusing on provider rate increases, giving more money to mental health professionals. They also decide our policies. They decide the laws around involuntary commitment. They decide whether or not there's going to be more mental health courts. So it's their duty as elected servants to listen to us and to represent us at the Tennessee General Assembly. And so that's why we're doing this. And I do want to just give an example of how our stories can make a difference in one particular bill that we've been working on. And it involves the process for involuntary commitment. Right now, in state law, it requires 2 physicians to examine somebody and sign off on it. It's called a certification to get them transferred or shifted into a facility for evaluation, diagnosis, and treatment. Okay, so 2 physicians. Well, sometimes they're not available in the hospital. So there is a bill that would allow a psychiatric physician assistant or nurse practitioner to do the second examination. And we're okay with that, right? But the way the bill was written is it allows for that second certification to be lifted in non-public hospitals. So your private hospitals, your nonprofit hospitals, it would only take 1 physician or psychiatric professional to do that sign off. And that's where we have concern. We sounded the alarms. We sent out a big advocacy alert, and I will get you guys on that list if you're not already on it. And we asked everybody to contact their legislators on the committee who were supposed to hear the bill yesterday and then this afternoon. In fact, the committee meeting should be starting. Here's the thing. They had so much pushback and so many complaints or concerns lodged that both in the House committee and in the Senate committee today, the bill sponsors postponed the bill because they're trying to work out a compromise. And NAMI Tennessee and other advocacy groups are being included in the discussion. So this is a perfect example about how advocacy can truly make a difference in a bill, okay? And you'll see that more next week too. So again, why are we meeting with state, House, and Senate members? They represent us. The 95 counties in Tennessee are split up into political districts. And your address determines which senator and House member represents you. So there are 33 Senate districts. So the state's all carved out into 3 districts. Generally in geographic regions, there's all kind of politics and how the district lines are drawn, but I won't get into that. And then we've got 99 House districts. So each district is represented by 1 person in the House and 1 person in the Senate. And when it comes to politics, all politics are personal. One-on-one meetings with them or meetings with small groups, they're super important. It gives you an opportunity to get to know the legislator on a personal level. Communication is important. What you say and how you say it is important, which is what we're learning today. The goal is to make a connection. And when you meet with the legislator, it's not all one and done there. You can follow up with emails. You can invite them to NAMI affiliate meetings, different events. So it's all about cultivating a relationship. So you could set up in-person meetings. Some of them will do Zoom calls. This was more prevalent during the pandemic with the lockdown. You can also get them on a conference call. Emails, that's one way to reach out to them. And finally, letters. It's interesting because what we're hearing from aides now is that letters carry a lot of weight. It used to be that they'd get a letter and just, put it aside, and that emails were really effective, and the number of emails, it's important. But now letters are becoming more prominent because it signifies that somebody took the time, sat down, wrote out a letter, and mailed it. Okay, so don't dismiss letters necessarily. Now we're going to get into planning a meeting. Like I mentioned earlier, we are asking you to set up an appointment with your legislator for next Wednesday if you're joining us for Day on the Hill. The first thing we'll need to do is find out who your House member and senator are, find out who they are. And then you're going to determine who's going to attend the meeting, and we'll help you figure that out. It might be that for Day on the Hill, there might be 2, 3, 4, 5 of you in a meeting, and we'll figure that out next week. So, but if you're not joining us for Day on the Hill and you want to set up a meeting, let's say after the legislative session ends, figure out who you want to bring to the table. Okay, do you want to bring a mental health professional? Do you want to bring your son that just had the mental health crisis and is in recovery? Who's going to help you deliver the message? And you call for the appointment, and then you prepare for the meeting. And I'll walk you through all these. How to find your House and Senate member. The easiest thing to do is to just Google "Find My Legislator Tennessee," because it's going to bring up this page on the state government website that will lead you to this. And it's a map of the whole state. And don't worry about the map. I mean, you can click on it and find your location, but it's easier if you go all the way down here. It says, try using our direct address lookup. This is much easier because you can type in your address right here. And in this case, this is not my address. This is the address of the state capitol. And what pops up are the names and pictures of the people who represent where you live. And so in this case, the district of the state capitol is represented by Representative Bill Beck and Senator Jeff Yarborough. And what you'll do is they have their email addresses right underneath here, and you'll click on that, and then you write your email asking for an appointment. When we get together next week, or if you're setting up an appointment on your own to meet with a legislator, this is really important. You want to appoint a lead person to start the conversation. Second person can be the storyteller. The third person can be the asker, the person who makes the ask. Now, this is an ideal situation if you've got lots of time and there's no pressing appointments before or after you, okay? On Day on the Hill, as I mentioned earlier, you might have 15 minutes, you might even have 10 minutes. So it might not play out like this. Also keep in mind, it might be that the legislator sits down and they start talking to you. Like, well, here's what I think about Senate Bill 1102. And you might not even have a chance to tell your story. I just want you all to be aware of that, because that could happen. But a lot of times the legislator will sit back and say, hi, what can I do for you? And that's when you start. Your lead person starts, your storyteller chimes in, and then the person making the ask also comes in. Again, if he or she has to cut the meeting short, all you need to do is say, I would love to follow up with you. We'll send an email, or you can also set up another time to meet when they're back in the district. Okay. They're going to make time for you. They will make time for you over me and registered lobbyists, because you're a constituent, you're a voter. That's important. Okay. So here's how you prepare. it's really important to check out their background. And you can just Google the name of the legislator and put, Representative Bill Beck, Tennessee. And what will come up is some of their activities, organizations that they belong to, high school, college. And the reason you want to do this is because you want to create points of connection. You want to establish a connection, not only with mental health, because you're sharing your story, you're also presenting yourself as a mental health expert, believe it or not, because you have the lived experience with mental health. But there's also other points of connection. Maybe your kids went to the same school. Maybe you went to the same college, maybe graduated in a couple different years, but you still have that connection. Maybe you go to the same church. Maybe your kids played soccer together. And that helps them remember you that much more. Connection is critical. So as part of the preparation, you want to prepare a message, which is what we've done today with your story. Know your ask. What are you asking for? And have your story ready. So what happens when you're in the meeting? And you might be nervous, and it's okay, but just remember they are regular people too. And you want to introduce yourself, explain why you were there. This is where you give the story. You want to refer to them as representative or senator. If you screw that up, that's fine. If you call them the wrong person, if you call the senator representative, that's fine. They'll get it. You want to deliver your message, and you want to thank them. Be sure to thank them at the end. So here's some do's and don'ts. And some of these have come up in meetings that I've been in, some not, just, an area of caution. You want to share your story, but make it very brief, 2 to 3 minutes. Sometimes you can go over, you can gauge the legislator. If they're looking at their clock, if they're fiddling with papers, wrap up your story, okay? Again, be aware of your time. If you can't get in to meet with your House member or senator and the aide wants to meet with you, absolutely take that appointment, because the aides, here's a secret, the aides often know more about what's going on than their bosses. And they're the ones that keep them in check, get them to the meetings on time. What they do a lot of times is they will keep a folder and say something like this, and before a legislator goes into a meeting, they will hand them the folder for that committee meeting with all the bills and all the follow-up, the background materials. So like maybe it's your story that you've already emailed them, or maybe it's a policy paper that I from NAMI Tennessee emailed them for a particular bill. The aides get all that stuff together, so they see the issues coming up, they get all the materials together, they know what's going on. And then finally, like I mentioned, thank the legislator, offer yourself as a resource. And you can also follow up with any materials like a policy paper, which we'll have available online and next week for you. And if there's a news article that you want them to read, you can email it to them. So here are some things not to do, okay? Don't stress. You do not have to get them to commit then and there that they're going to vote for a bill. A lot of times there are a lot of last minute negotiations. There are other people that they need to talk to. They might say, oh yes, I'm going to vote for this. And then you thank them and express your appreciation. But your job is to educate, okay? It's my job to lobby. It's your job to educate. And by lobbying, I mean like the hard press, get them to vote, ask them, are they going to vote? And just educate and share your story. Don't argue with them. Oh, okay. We have some background noise. If you can mute, that'd be great. Right. There are going to be some legislators that you're not going to convince. There might be some legislators who think that mental illness is just a character flaw. And, there are some people, and I need to warn you, that think that if perhaps we pray harder and read the Bible more, that perhaps the person would not be mentally ill. Okay. And I just need you to be aware of that, because if you encounter that, don't get upset. Just be aware that that's out there, and don't argue with them. Just understand that that's where they're coming from. And when you tell your story and when you present it in a very professional way or heartfelt way, it can make a difference. It can shift them. So,
Elisa,
yes.
if I may, and this is not to start anything, but in the Bible, there's so much stories about mental illness in there. Of course, they didn't have the words in there, but just, okay, that's all I wanted to say.
That's
Like
a good,
David, Elijah, I'll be quiet.
thank you for bringing that up. So in that particular case, it might be worthwhile to bring that up, but I would not belabor the point. Just make the quick point,
Yeah,
and
for sure.
who
I
knows,
was
maybe
think
that legislator didn't know that. So
I
you're
think it's so
again,
funny.
educate.
I think that's so funny. But thank you so much for this. This is such good preparation. We're gonna be ready.
All right, awesome. Don't dominate the conversation. Let other people talk. Don't talk over a legislator. Don't threaten a legislator if he or she doesn't agree with you. Don't say like, I'm gonna vote against you and I'm gonna get all my friends to vote against you and we're gonna support your opponent next time around. Bad, because you're building a relationship. Remember that the bill you're talking about today might not be one that he or she is in supportive of, but the bill you're talking about tomorrow, they could support. So it's not a one and done situation. You're building a rapport, you're building the conversation for a long-term relationship with this person. And finally, don't discuss presidential elections. There's so much stuff going on politically right now. And just be aware that if you are philosophically opposed, like if you're a Republican and you're meeting with a Democrat, or you're a Democrat meeting with a Republican, remember, mental illness has no boundaries when it's a red state or a blue state, or if you're a Republican or a Democrat. Okay, just stay out of the political discussions. Don't discuss campaign contributions. This has actually come up in a meeting that I had a few years ago, where the person was really excited about the legislators' support. Said, where can I give you a campaign contribution? I'd love to contribute to you. You can't talk about that. It's actually illegal to talk about that on state grounds, on state government grounds. Their offices as a state legislator needs to be separate from what they do for fundraising. And it has happened and people just don't know. And that's why I'm here to tell you. Never connect a campaign contribution to a vote on a bill. Like, I'm going to withhold money if you vote against this. That's no. And this last one, this has actually happened, and boy, this did not go well. If you're writing up a report or sending an email to your colleagues, maybe your NAMI affiliate, to the steering committee or the other members about your day on the Hill experience and what people said, be careful what you put in an email or put in writing. I had a situation where I did a Day on the Hill event several years ago, and somebody was writing back to their community about the Day on the Hill and wrote some disparaging comments about the legislator. Well, guess where it ended up? In that legislator's email box, because somebody forwarded it, and then forwarded it to the legislator, and that did not go real well. I don't think that legislator met with us the following year. So be careful what you say in writing. Oh, and another thing is anything that you put in writing to a legislator is subject to open records law here in Tennessee. So the media or the public can do a public records request of emails. And this happens. I used to be a reporter. I've done this in certain situations. But they could review all the emails, say, at a given time on a particular subject. So just be aware of that. If you meet with a legislator and they seem clueless about what you're talking about, keep in mind that your House member or senator, number one, might not have had a mental health experience in their lives. And wouldn't that be lucky? Maybe they have a loved one that has not had these experiences, or they themselves have not. Also, in the course of a day, they have people coming and meeting with them. They could be talking about solar energy. They could be talking about childcare, and then mental health is on their list for that day. They might not sit on committees dealing with healthcare or mental health. They might sit on local government or commerce and insurance. So just give them some grace. And as I've mentioned, relax. They're going to be okay. They might ask you a lot of questions. They probably will. They're going to be nicer than you think. They're depicted a certain way in the media, and I think you're going to be surprised. You do not have to be an expert in Tennessee Code Annotated Chapter 33, which is where all the mental health bills are, or all the mental health laws are. Okay, that's my job and the job of our lobbyists. Your job is to share your experience with your mental health journey and to educate. Okay. You are the expert. You don't have to know what's in the budget and what line item is for the Department of Mental Health and Substance Abuse Services. Don't worry about that. Okay. In the event that you're asked a question next week that you don't have an answer for, it's okay to say, I don't know. All right. I'm going to have forms for you to fill out the question and get back to me so that I can, or our lobbyists can respond to the legislator directly. It's okay to say, I don't know, but we'll get Elisa or Bill, our lobbyist, to get back with you. Okay. Have some fun with this. Remember to get a picture with your legislator. They love seeing themselves on social media. We all do, as long as it's a good picture of us, right? Tag them in the picture. If you post it on social media, any post that you do, keep it professional and positive. And then here are a couple hashtags that you can use. So, if anybody has any questions, we can get into those. Before you leave, though, I need you to fill out a survey because we need to measure how well we're doing with this presentation and make any improvements. So I'm going to put this in the chat box.
Can you put the slide up there with the hashtags one more time?
The slides?
Yeah, with that. Did you have a slide with the hashtags? I was reading the email.
I'll put them in the chat box. And this, by the way, this presentation will be hopefully posted today, if not by tomorrow.
Okay, cool. Thank you.
So that we want NAMI 10 down the hill, and then if you're a member of an affiliate, you can do NAMI Chattanooga. This is just an example, something like that. I'm going to give you a minute to complete the survey. And if you have any ideas for other advocacy webinars, let us know. Okay, I'm going to call on Jeff Layden. Where are you still here? Yes, Jeff. if you're available, if you want to share any comments.
I would, thank you. And Elisa, you're doing a wonderful job here, I think, with going through this. And what I want to say is it's wonderful to see so many people that I haven't met, because we always need to have more and new people to come. And I've seen firsthand how it makes a difference when the legislators hear from somebody that has personal experience with the issues that we're talking about, whether they're a caregiver or living with a mental health condition or working in the field, whatever it may be, that sometimes, Elisa and I've talked about this quite a bit, somebody can talk to a legislator and say, I want you to fix something. And all of a sudden there's a bill that might become law. And the people may not know that much about the issue. Like there's a bill now we're looking at related to children with disabilities in school and whether security officers can restrain them versus trained law enforcement. Well, the legislator may not know much about what's going on in a school and what kind of training and trauma for kids and how they get help and all that. But a family member of that child knows a lot. So that's just really great to see so many of you. I just really appreciate it. And that it makes a difference. People think that it doesn't matter. It does matter. And it can be calls, visits, old-fashioned letters, emails, that we don't want lawmaking to be in a vacuum. When we have this mission that we do to make things better for those impacted by mental health condition, whether it's an individual, family, community. And so that's really great. And yes, we look for funding too from the state to pay for people that cannot afford care, which is a lot of people, because mental health conditions and behavioral health care issues, including substance use disorder and co-occurring disorders and caring for loved ones and all these things can impact people's work also. And without working, you may not have insurance unless you're old enough for Medicare. So all this really matters. So some of it's laws, some of it is funding, and we need all of you. So thank you.
Thank you, Jeff. Also, like Jeff said, that sometimes when an issue is brought up in a conversation, the next thing a bill might pop up. Boy, oh boy, let me tell you about Suzanne Blackwood. Over the summer, Suzanne invited me to a meeting down in Murfreesboro with Senator Reeves. And the issue was about ED boarding, emergency department, emergency room boarding. And that's when, as Suzanne mentioned, a person in a mental health crisis is kept in the ER for several days, and because they're not transferred out to a mental health facility, a treatment center for evaluation, diagnosis, and treatment. And we had this meeting, and I remember talking to Senator Reeves and saying, 988 is getting ready to launch. So now you're going to have all these people calling 988. They need the services. They're going to go to the hospital. Are we going to have the services available when they need them? And he had no idea about that connection. So this year, just last month, Senator Reeves filed a bill to address the emergency room boarding issue and to make it easier. It's like an online system for the treatment centers to put on there how many beds that they have available. So the hospital knows when and how quickly they can transfer somebody into an available bed. So the idea is to have this statewide system that does that. That came from a meeting that Suzanne and other advocates attended, including some people from, I think, Cannon County. We have some NAMI Tennessee members there as well, in other advocacy groups. So it works. I'm telling you, you can make a difference. Okay. Do you have any questions? We have a few more minutes.
For for next week, will there be an itinerary or anything like that provided so we kind of know the order of operation there and how that's going to look?
Yes, so if you are signed up, we will be sending that out in the next few days. I'm also going to send out information on where to park. It might be easier, Jarvis, you know, it's Davidson County, it's Nashville. Might be easier to Uber
Yeah.
down there.
Mrs. Jones will hopefully be dropping me off.
Okay, okay. So I'll send out parking information, the agenda, any little tips that you need to know in preparation. So yes, all that will be available. If you want to learn a little bit more about advocacy, I have created a toolkit that walks you through many of the tips that you learned about here today. That is on our website, which is namitn.org. I'm going to type it right here and click on the advocacy tab and go under the advocacy series, and you'll see the toolkit. I think it's under last week's event, but you'll see it on the left-hand side. And that's for you. That is for you to download, learn from. You can follow the guide to write letters to lawmakers, just like we talked about here. Okay. One thing I'm curious about, and you can type this in this chat, how did you find out about this webinar? We have people as far away as Florida on this call. This is great. We have students on this call. Love to find out how you learned about this. Okay. Suzanne says, Jeff, thank you, Jeff, for promoting it. A health policy class. Okay, email. Awesome. Seems like word of mouth. Health policy, excellent. So seems like health policy classes would be a good place for us to reach out to in the future. Email. Health policy. Okay, awesome.
And is it Alyssa or Elisa? I'm so sorry.
It's Elisa, and trust me, I'm asked this nearly every day.
Elisa.
It's okay. Yeah.
Is this the only time this year that we'll be doing this at the Capitol, or would it be a fall session, or is it typically just once a year?
This is once a year. Our Day on the Hill event is once a year. The legislature meets starting around the second week of January, end of April, May, and we do this once a year. You know, there might be a conversation about doing something else in another part of the year, some kind of training. We're always open to that. That's why if you want to put that in the survey that I posted in the chat, that would be helpful.
I'd like to give a commercial for Elisa that there's other opportunities during the year. They're just not visiting our state legislators in person because they're not in session after they approve the budget. They leave in May. But sometimes there's federal issues, and Elisa, you do advocacy alerts from time to time. And if people aren't signed up for those, what do they need to do to get those?
Email me, and I can put my email in the chat, and then I can put them on our email blast list. In fact, I've just put 2 more in this morning. So I do the advocacy alerts maybe every other week during session. If there's something that needs immediate attention, I'll do them more often. But here's my email address. Oops, hold on a second.
And before you break, Elisa, there's something else I want to mention here when you tell me it's okay.
Yeah, sure. Go ahead.
Okay, I see students here, and if any of them are 19 or below, we have a campaign going where we're looking for some short mental health awareness videos that are done by teens, and it's on our NAMI Tennessee Instagram and Facebook page now to try and just get some messaging for Teen Mental Health Month, or Teen World Mental Health Day, I think it is, which is March 2nd. So I don't know if any of you are teenagers. If you're college students, you still could be a teenager. If you're not a senior or grad school, check it out. on our Facebook page, please. NAMI Tennessee Facebook or Instagram.
Great. Thank you. And if you want to expand your storytelling skills, we have other opportunities at NAMI Tennessee. There's a program called In Our Own Voice that teaches you how to speak to groups and share your story. So it's a little bit of a different use of your story. It's for mental health education. And ending the silence. Jeff, where are we on that? The ending the silence?
Well, the same person that coordinates In Our Own Voice coordinates Ending the Silence, Alondra Soto. And the difference between the two is the Ending the Silence program, a young adult with the lead presenter works with school-age children or school personnel or parents of students, while the In Our Own Voice can be a Rotary, a church, a workplace, a mental health center. It's not youth focused in the same way.
Right. There's a lot of storytelling opportunities. I want to point out something that Suzanne shared in the chat. I've learned that a lot of work can be done between legislative sessions. Okay, so that's called the interim months. In fact, that gives legislators time to work on bills without being rushed and up against deadlines. Yes, because they're so much more relaxed when they're back at home and they have time. Sometimes they'll meet with you in their law office or their, whatever office they work in, much more casual. So it's a great time to sit, exchange ideas, brainstorm. So highly recommend that. And if you need help, if you want to contact a legislator and meet with him or her, contact me. I can help you do that, walk you through what it might look like. Yeah. So, well, thank you all for being here. I'm going to stop the recording, but am available if you all want to walk through your stories. Okay. Thanks so much. And just remember the power of your
Elisa,
story. Yes.
I'm going to throw in another little thought. I've been known to do this. If you're ever in Washington, D.C., these same skills work there. And it's kind of fun to go and visit with one of our senators or our members of the House of Representatives. And I'm part of NAMI and I care about mental health. And Elisa can help you with the federal issues of the day as well. And I get to do that every year, but other people from time to time, they may be in Washington, and you can get tickets to the White House sometimes too, if you ask them when you're there, that kind of thing. And you may not get to talk to the senator, you may get a staffer that's expert on health policy, and that can be better because they have more time to listen to you. So that's kind of cool too. And I do encourage people, I don't know, who you all are and what you all do with your work and that, but some people make it to Washington and keep it in mind. And Elisa will help you if that would come up.
That's a great point. Our NAMI staff in Washington is really great, and our policy people, they do a really good job. Another thing I want to offer is if you want to send me your story, if you want to type it up, I can help you pare it down. Okay. So I just want to make that offer. All right, I'm going to stop the recording.
I'm sorry.
Oh, it's okay. But I'll be available. We'll stay on. So thank you so much. This has been really great.